Dr. Arpitansu, and today we'll be talking about some common IPD cases encountered in a hospital setting. Before that, we'll first discuss how to write a case paper for new admission in detail, enlist some common disease in a hospital setting, how to write daily rounds, some common investigation in different condition, and then discuss in brief the treatment protocols followed for various disease in a hospital. Now this video is purely practical oriented and some might find the treatment protocols a bit different from what has been written in the books. So without delaying any further, let's begin. To write a case paper for new admission, you should first divide your prescription paper in three sections. On the left side, you should write all the investigation which you will prescribe to the patient. And on the right side, all your treatment protocols. In the mid section, you'll write all the details of the patient starting with his age, history, complaints, examination, and diagnosis. To begin with, the very first line should mention the name of the doctor who's treating the patient. S by B is the abbreviation for seen by. So the first line goes S by B, Dr. Arpit. That is seen by Dr. Arpit or whatever is the name of the doctor. In the next line, you should mention the age and gender and with what mode of transportation he used to visit the hospital. B by B is the abbreviation for brought by. So the second line goes like, let's say there is a 13-year-old female child. So a 13-year-old female child brought by either a private vehicle, a police van, a 108 ambulance or anything else. Now if he is being referred from any other hospital or PHC, mention the name of the referring hospital and why they refer the patient as well. IVO stands for in view of. So the next line goes like, let's say he is being referred from a PHC setting, that is a primary health center setting, for blood transfusion. So referred from PHC in view of blood transfusion. After that, begin with the complaints of patient. Use the same words as used by patient. Mention their problems and duration. Like cough since 4 days or tinnitus since 10 days. Ask the patient whether they have any history of hypertension, diabetes mellitus, COPD, alcohol or smoking history, and mention it in the next line. After that, examine the patient's vital and mention them as on examination. Whether the GC of the patient, that is general condition of the patient, is fair, moderate, poor, whether he is gasping or drowsy, whether he is semi-conscious, unconscious, or not responding at all. Check for the temperature. If the patient is afebrile, mention it. And if he has fever, write febrile with a degree of temperature, that is 101 Fahrenheit, 99 degree Fahrenheit, etc. Record pulse, BP, SpO2 and mention it. If possible, check for the respiratory rate as well. Now check for the system. In cardiovascular system, look for the S1, S2 sound, if it is normal or not. Check for any other murmurs. In respiratory sound, check whether the air entry is bilaterally equal, clear. If there is any wheeze, it can be a case of asthma. If there is any rhonchi, it can be a case of bronchitis. If there is any crepitus, pleural rubbing. Examine the CNS as well. After that, do the per abdominal examination. Check whether the abdomen is soft, non-tender, and if it is tender, rigid, mention the area of abdomen among the 9 quadrants of the abdomen. Also do the local examination. Look for the pylority and icterus in the sclera, skin, nails, tongue. If there is any edema present on the legs or hands, check whether it is a pitting edema or non-pitting edema. Whether there is any lymph adenopathy in the axillary region or submandibular region, check for that as well. Look for the nails for clubbing and cyanosis symptoms as well. Review all what has been written in the midsection and conclude your final diagnosis. Moving on, we'll mention some common diseases that or common diagnosis which is encountered in a day-to-day basis in a hospital setting. Some common diseases which we find are AFI, which is acute febrile illness, pyrexia of unknown origin, typhoid, enteric fever is also very common, dengue, dengue fever, dengue hemorrhagic shock with or without thrombocytopenia, and a urinary tract infection for cystitis. Alcoholic intoxication with or without hypoglycemia and delirium is also very common. Liver diseases, whether alcoholic or non-alcoholic, hepatitis, cirrhosis, ascites, INCAF, or coma are all common. Hypertensive emergencies are also very common. Chest pain and CVA under evaluations are also seen every day. You should also know about how the treatment protocols for convulsion, epilepsy, or status epilepticus work. Some common OPD problems like URTI and LRTI are also seen. Any status asthmaticus management should also be known. Diabetic ketoacidosis is a serious management and you should also know about that. AKI, CKD are also seen. Severe anemia need blood transfusion, iron sucrose. There are a lot of poisoning cases as well, but the most common in India setting is OPP poisoning. Snake bite is also very common. Road traffic accidents occur every day. Some MLC cases like alleged assault, head injury, these are also very common. Fractured chest trauma, these are also common. DOTS regimen for Cox disease and tuberculosis leprosy should also be known by doctors. Coming to the daily rounds. Daily rounds, writing a daily round is not very much different from a new admission. The only thing that is new in the daily round is the fresh complaints. Rest of the format is same as the paper for new admission. The only new thing that is being added in the daily round is fresh complaints. If there is any missed history that you came to know about from the first time of your encounter, if you have changed your final diagnosis, then mention that as well in your revised diagnosis. And if there is any new investigation that you have prescribed to the patient. If there is any relevant investigation report, mention that as well on the left side of the paper. Apart from that, all the format of the daily round is same as the new admission. Some common investigation that we do, like whenever a patient is being admitted, it's a routine procedure to always do CBC, LFT, RFT. Check for the sugar level, that is, do the random BSL. If there is any febrile illness and the patient has any joint pain, nausea, vomiting, retroorbital pain, do the dengue NS1 test, do Vidal test. If there is any burning sensation in the micturition, do the urine routine or microscopy as well. If there is cough present from a long duration, do the chest x-ray as well. If there is any trauma to the chest, do the chest x-ray. If you think the patient has angina, do the ECG. If you feel like the patient has jaundice or hepatitis, check for HBsAg, HCV, HIV. If there is any respiratory disease, do RT-PCR, rat examination, sputum examination. If there is any female who has amenorrhea, check for the pregnancy test, do UPT. If there is any poisoning case like OPP, check for the serum cholinesterase level. It should be more than 4000 for normal. If there is any snake bite patient, do BT-CT every 6 hourly. If there is a case of myocardial infarction or ischemic heart disease, do CPK-MB or lipid profile. Check for the serum electrolyte if there is a case of hypokalemia, hyperkalemia, diabetic ketoacidosis as well. If there's any head injury, check for the CT brain. If there's a convulsion and CVA, check for the CT brain. Now, this was a part 1 video. In the next part, we'll talk about the common treatment protocols that we follow for various diseases. If you like the video, do give a like, subscribe. Thank you for watching. We'll meet in the next video. We'll talk about not much in detail about the pathology, but we'll focus mainly on the practical treatment protocols followed in a hospital about various diseases. We'll talk about AFI, dengue fever, OPP poisoning, rat kill poisoning. We'll talk about gastroenteritis, severe anemia, chest pain, CVA, head injury, convulsion, snake bite, ascites, dog bite, alcoholic intoxication as well.